The federal government has placed a ban on leave of absence for health professionals relocating abroad. The Minister of State for Health, Tunji Alausa, said that health workers going abroad to seek greener pastures must henceforth resign their appointment before embarking on such journeys. The minister, who spoke during his visit to the Neuro-Psychiatric Hospital, ARO, said the directive was contained in an executive order issued by President Bola Tinubu. The minister also disclosed that the federal government had commenced aggressive recruitment of workers in the health sector. According to him, the annual enrollment of nurses, which used to be about 28,000, had been increased to 68,000, adding that by the end of the year, it would have gone up to 120,000. Now, joining us on the news is Dr. Abdulgafar Kolade, President of the Association of Resident Doctor Neuro-Psychiatric Hospital, Aro, Abeokuta. Hello, doctor. Thank you so much for joining me this evening.
Thank you very much. Happy to be here.
All right. So can you share your thoughts on the recent federal government's ban on leave of absence for health professionals relocating abroad, and what impact do you foresee it causing on the healthcare sector?
Okay, once again, thank you very much for having me. The pronouncement of the Honorable Minister about the ban of leave of absence by medical professionals. I think it is still a new development, and we don't know yet until when we have a document that is backing it up. It's very wise to be gathered in one's comments about that. So usually when there is a policy of government, there will be a document that will back it up. So I think it's an ongoing thing, and then we have to wait until the federal government releases a document to back that up.
All right, so doctor, now what about the Doctors Association? How do you think that they can actually work collaboratively with government to ensure that the aggressive recruitment of health workers translates into improved healthcare infrastructure and also funding or even welfare packages for the benefit of the entire workforce?
Thank you very much. Like we all know, there is a manpower shortage in the health sector generally. So I think the government is working on increasing personnel in the healthcare workforce generally. So I think that will go a long way to help some of these challenges. And as well, so the infrastructure that should be available should actually also capture, to focus on what will benefit the patients. And of course, it's a good long way to hone the skills of professionals, and they also have the job satisfaction when they work with tools that they need to work with. And so that is very important. And as well, the welfare of doctors is very, very key. And so there has to be welfare packages that would make sure that the environment is enabling for them, and then they're able to stay back, to give back to the society and then carry out their primary responsibility of taking care of patients. So for doctors in training, we know that there is what we call the MRTF, the Medical Residency Training Fund. And so it should be very good for some of these packages that are welfare packages for training to come very early here. And then so the process by which they are being processed and also will make it simpler and easier. So this will be a very long way to also improve workability in the healthcare sector for doctors particularly.
Okay. Now, in light of the brain drain challenge or Japa syndrome challenge, how can medical association engage government in order to find balance between retaining skilled health professionals and also respecting individual career choices to work abroad? Because as it is, it doesn't even seem like the government is interested in healthcare workers, traveling abroad to work at all.
Yeah, so once again, thank you. I think that there has been engagement and have been forum by which, through which the association interacts with governments at the level of the hospitals, as well at the level of the federal government. So this engagement will continue definitely, and I think that has been continuing. But additionally, I think that, like I said previously, the environment has to be made more suitable for professionals to work with, so that the pull factors, they are more than the push factors. So, I mean, factors that actually make people to want to stay back in the country, to give back to the society. So the job environment has to be very nice. The allowances has to also be they have to be very good, and they can actually improve on some of this. So I think that if there's improvement of this, because the emphasis should actually be on retaining the workforce, so you can actually employ as much as possible, but you need to find a mechanism by which you can retain the ones that are moving into the system. So once the work environment is very suitable and very good, people will have less reasons to want to travel out for whatever reason, be it for better pay, be it for education. So if all of these factors are taken care of, I think we'll be good.
All right, now still talking about factors that should be taken care of. Now, considering the concerns about funding and infrastructural development, what specific initiatives can you recommend to enhance the quality of healthcare delivery in Nigeria?
Well, so I think it borders on training and retraining of personnel and retaining the workforce, and then providing infrastructure for which you can work with. So many people want to leave the country because they do not have the enabling equipment to work with. So I think if the government can actually improve on getting this equipment available, so people would then be more happy to stay. And so that's talking about infrastructure.
Okay. All right. Well, thank you so much, Doctor, for joining me and speaking on this issue.
Thank you for having me.